Some people go out of their way to hide an illness. I read a story amongst many in this book about a rich couple, and she made up a name, the Nelsons. Gavin Nelson of Nelson Enterprises. I don't believe that exists, but I looked him up and I didn't see anything on him. I think she made up the name, but he brought his wife in to the hospital, an emergency room, because of shortness of breath, and she acted like she was fine, and she was looking forward to leaving early, but they decided to take her from the emergency room to the heart health cardiac ward area, and just kind of check her out a little bit closer, just go through the procedures. Because they came from a lot of wealth, the doctors decided to give them a little, I think, extra special treatments, and the nurse Heron talked a little bit about those concerns that rich people get a little bit more like attention and stuff. But they bring her to the unit, the heart health cardiac area, and normally they wheel them in on a wheelchair, but she could walk. Mrs. Nelson could walk in on her own. She had the strength and all that, even though she was like a little low on energy. And she was saying, hey, I'm fine. I don't know why I'm here, but let's just get this over with. I got a party. I got a host for 20 people in a few days or so. So she gets she gets told that she needs to be put in a medical suit, just a little tie-in thing. The reason they have them is so they can get their blood pressure checked easier. It's easier access to the veins and stuff. And she asked, why can't I just have something sent from home? Just to get the mindset of Mrs. Nelson. She's just living in a different world. And it said that she is very headstrong. But she slips into the medical outfit, and it slips, burying her. When Nurse Heron walks in, she saw the medical thing slipped and buried Mrs. Nelson's chest a little bit, and it was just that moment glance where the Nurse Heron could see now what the problem was. She said that there were black splotches on one breast and a concave where the nipple used to be. She said she could almost see the muscle, and it really looked horrible. And then she starts asking Mrs. Sandra Nelson how long that's been like that. And she said, "Oh, it's just a bruise from shears. I just got my breast caught on some shears or something like that." And this happened like 2 years ago, and the bruise that occurred from those shears got worse and worse and worse over time. But she kept living in denial of it and ignoring it, and her own husband was unaware of it even. He saw the bruise when it first happened, many months ago, but he didn't realize that it progressed to this far. Mrs. Nelson was 42 years old. That sounds kind of young to me to have this problem. It pretty much breast cancer, and so she kind of had pain, but she had shortness of breath, and the doctors checked her out closer and in more depth, and just she did not she didn't want to take any pain pills, but the doctors discussed it and said that she's only got like a few days left to live. Okay, and within a matter of days, in fact, on the very day that she had her scheduled party, she died. Um, you know, this is like not entirely true. She makes up names and stuff, but you know, it really, the things that these exact sequences of events, the exact sequence of events may not have happened. Um, but I mean, you get the idea. This type of stuff does occur. People will live in denial of bad health. Not me exactly. I'll get scared over anything. I'll complain about everything. Like my neck is still a little bit stiff from about a week and a half ago. I'm still a little concerned about it, but it seems like it's getting a little bit better. But there are people who will try to hide their medical conditions, and then it becomes for too long. They'll do it for too long, and then it becomes a big surprise when it's too late to save the person. You know, she could have detected her breast cancer a lot sooner. She could have done something about it a lot sooner, going into the hospital and having it taken care of, but she didn't. And you know, it wasn't about money to her, I guess, even though she, you know, with Gavin Nelson being able to afford anything, she didn't want to alarm anybody. So rich people live in denial too of health problems and ignore them. And that's what she did. She lived that upper class lifestyle, taking care of extravagant parties and all that, and then suddenly she was hit by this illness. As she started out getting a little tired and stuff, but then the shock really hit her, and when the nurse had to break it to her that actually nurses can't legally break this type of news to the patient. It's the doctor who has to. She said, the nurse Heron said that her demeanor changed. She aged 20 years, and her husband aged 20 years. And at the end of her life, it's really sad how the nurse describes it here. The author describes it, but when they knew she was all about to expire, the husband went in there and he laid by her bedside, and then just kind of held her and every so often like squeezed her hands and kissed her like forehead until she passed away. It's sad. It actually made me cry a little bit. But it's just it's amazing to me how she kept her breast like hidden from him for all those months as she was getting divots and weird bruises in her breasts. So it's something to be concerned about. You really want to be aware of you know, if you have a partner, may do an inspection of their body, get an assessment, a decent assessment. Low energy, I mean, that's a good indicator. You want to ask a few more questions. Why their energy is low? What factors are causing that? And you want to treat those conditions a little bit earlier. You don't want to ignore the little things. And that's one good thing about acupuncture, is they don't ignore the little things. They want to know how your poop is and what you're eating, how you feel, how's your blood pulse doing, not just, you know, 70 beats a minute. They want to know, is it spongy, is it erratic, is it smooth? There's a lot of different color of your pee, but some people live in denial of that. Why? It's a pride thing, I guess. I'll hide some things too, at times, but I'll complain, and I think it's a healthy thing to complain. Just that's my opinion, though, and I'll leave it at that.